Hello everyone. Today we're going to be talking about some of the stress-related disorders. Again, just want to remind you that we are not mental health professionals, so please do not try to diagnose yourself, your family, or your friends. Before we get into disorders, let's talk a little bit about stress and what it does to the body. When a person is stressed, it activates the sympathetic nervous system, more specifically the autonomic nervous system, which is responsible for the fight or flight instinct. It releases a stress hormone called cortisol from your adrenal glands, and it inhibits the parasympathetic nervous system, which on regular terms would undo the work of the sympathetic nervous system, decreasing heart rate and blood pressure and increasing digestion. But when stress is always present, the fight or flight response stays activated, and your body becomes overexposed to cortisol, which disrupts the body processes and increases risk of health problems due to weakening immune system. The first disorder we're going to talk about is adjustment disorders. This is characterized by maladaptive reaction to a distressing life event or stressor that develops within 3 months of the onset of that stressor. Examples of stressors that can cause adjustment disorders are death of a loved one, divorce or problems in a relationship, or even illness or health issues in yourself or in a loved one. Here are the symptoms for adjustment disorder according to the DSM-5. Emotional or behavioral symptoms develop in response to an identifiable stressor or stressors within 3 months of the onset of the stressor, plus either or both of the following: marked by distress that is out of proportion to the severity or intensity of the stressor, even when external context and cultural factors that might influence symptom severity and presentation are taken into account. Significant impairment in social, occupational, or other areas of function. The stress-related disturbance does not meet criteria for another mental disorder and is not an exacerbation of previous mental disorder. The symptoms do not represent normal bereavement. Symptoms do not last longer than an additional 6 months after the end of the stressor or its consequences. There are several types of adjustment disorders. The depressed mood type refers to symptoms mainly including feeling sad, tearful, hopeless, and experiencing a lack of pleasure in things you usually enjoy. With the anxiety type, symptoms include nervousness, worry, difficulty concentrating or remembering things, and feeling overwhelmed. With children, it may look like separation issues. With mixed anxiety and depressed mood, we see a combination of both symptoms. Disturbance of conduct include problem behaviors such as fighting or reckless driving, and in youth, this may include skipping school or vandalizing property. The mixed disturbance of emotion and conduct refers to symptoms from depressed mood, anxiety, and conduct. The unspecified type includes symptoms that don't fit the others, but often include physical problems, problems with family or friends, or work and school problems. The prevalence rates can go anywhere from 5 to 20% of the population. Traumatic stress disorders. There are 2 main types: acute stress disorder, ASD, and post-traumatic stress disorder, PTSD. The only difference is in duration of symptoms. For PTSD, symptoms must last greater than 1 month. Both can develop after the experience of a traumatic event, witnessing a traumatic event, learning that a traumatic event happened to a close family member or friend, these are mostly life-threatening events, or repeatedly experiencing or hearing extreme details of the traumatic event. A variety of emotional disturbances and symptoms are associated with stress disorders and cause clinically significant distress or impairment in the person's social/work life and functioning. To be diagnosed, you have to go to a trained clinical psychologist who will run a series of assessments and come up with your diagnosis. There are several types of PTSD. Preschool PTSD refers to anyone younger than 6 years old, but they have their own diagnostic criteria. Dissociative PTSD refers to the presence of persistent or reoccurring depersonalization or derealization, which just means experiencing something as if they are an observer to themselves, or sensing as if the things around them are not real. Delayed onset is pretty self-explanatory. The criteria are not fully met until 6 months after the event. And complex PTSD refers to cases of chronic, reoccurring traumatic events. What factors influenced the development of PTSD? Before refers to genetic factors, past stressors, family history with PTSD, and things like that. During refers to what happened. What was the traumatic event? Was it reoccurring? Did it only happen once? How long was the duration? If they heard about it, how many details did they receive? How close were they to the victim? After refers to how they reacted, what coping mechanisms were used, and how did the people around them react to the situation. There are 4 features of traumatic stress disorders: re-experiencing the trauma, avoidance behaviors, negative cognitions and mood, and heightened arousal. The first refers to intrusive memories, triggers, flashbacks, and nightmares. Avoidance behaviors show that people avoid reminders, people, places, conversations, thoughts, feelings, and anything that may trigger traumatic memories. Negative cognitions and mood. Often, we see cognitive distortions around themes of trust and guilt. An example of this is getting in a really bad car accident with a black SUV that was driving extremely recklessly. The person might experience a cognitive distortion that people who drive black SUVs are reckless, depressed or unmotivated mood, social isolation, and a sense of foreshortened future. And lastly, heightened arousal. We see a lot of irritability, anger, reckless or self-destructive behavior, hypervigilance, exaggerated startle response, concentration difficulties, and sleep difficulties. And about 9% of the population state having experienced a traumatic stress disorder within their lifetime. Helping, coping, and treatment. When it comes to helping, a person must understand the definition of traumatic event. They need to be able to identify signs and be willing to offer help even if the person is in denial at first. But there are some ground rules. Never be pushy. Do not force a diagnosis and don't make them feel like something's wrong with them. Never say I understand, even if you've gone through something similar. And do not ever compare situations. Everyone's trauma is their own, and everyone will react differently. When it comes to coping, a person needs to learn to cope with anxiety. They need to find healthy ways to manage emotions. They need to learn how to cope with unpleasant thoughts and memories and manage their sleep problems. They also need to know their triggers and how to deal with them. Lastly, treatments. There have been a number of treatments that have been found to be effective in helping cope with PTSD. Some include cognitive therapy, exposure therapy, acceptance and commitment therapy, and eye movement desensitization and reprocessing. Thank you so much for tuning in, and I hope you like and share this video.